we need leaders that really demonstrate through their actions a commitment to us achieving patient and family-centred care for adults with congenital heart disease, including those with heart failure. It's critical that the care that we provide meets industry and quality standards, and a key measure of that is care being accessible. And so there's different ways we can provide accessible care. One is, can we get people into the clinic to see them face to face? But we can also use telehealth so that we can reach out to people in their community. We can also help to improve access to key information that helps patients and families decide on the timing of the care that they receive. So all of these things are being integrated into the Signal program so that we can improve accessibility for our patients. Integrated care is referring to care across multiple specialties. And I like to think of it as, imagine a hallway with lots of rooms, and in each sits a specialist. One might be a physician, one might be a pharmacist, a social worker, a mental health provider, a surgeon, and so on. I think what Signal is aiming to do is to break down the walls and really change the thinking to a circle, so that we have all of those specialties surrounding the patient who is centred, and that circle of care is there to respond to the many needs that adult congenital heart disease with heart failure has. That is true integration. There's also another level of integration, which is going beyond the hospital walls and into the community. And so we need to think about, how do we bridge back to the community specialist and the community primary care provider so that they're part of the conversation and that between clinic care. So I define community as those that have the most to gain and the most to lose. And so in this conversation, it's my adults with congenital heart disease that's been complicated by heart failure. And they're really who we need to listen to when it comes to identifying our priorities. So we're starting that work by forming a patient and family advisory council for the work that we are leading. And there's a second community of healthcare providers with a shared commitment to these patients. And what we want is a dialogue between those communities so that we're staying on track and being true to the needs of patients and families with these challenges. Believe it or not, we often get it wrong. And we don't want to come up with programs that are for the sake of just program building. And we don't also want to lead research that is for the sake of research. We really need solutions that deliver meaningful benefit to those that are coming to us for care. As knowledgeable as we might be, we are not experts in the lives of our patients and the daily realities of those lives. We need to listen to understand what those daily realities are from the experts, the patients and the families themselves. And that's how we will be able to prioritise the solutions that are most important to them. In some cases, they're actually quite simple. For instance, access to reliable information. We don't want to skip those steps because we're focused on some digital tool that is of interest to me but isn't the number one priority for my patients. Our goal is always to provide evidence-based care. The evidence base for heart failure and adult congenital heart disease is one that's relatively new, but it's growing, and the Mayo Adult Congenital Heart Program is one of the leaders in growing that body of knowledge. What happens today with the clinical decisions that we're making? Should you start one medication or not? Should you go ahead and have a transplant or not? We want those discussions to be informed by evidence, but sometimes the evidence is just not there yet. So the approach that we're taking is one that involves shared decision making, in which we can review the existing evidence, even though that might be at an early stage, and we can talk through the pros and cons of different pathways with our patients and help reach a decision that's the best for that patient based upon their needs and priorities.